Welcome to the Smart Weight Loss Coaching Podcast. I'm Dr. Lisa Olson, a board-certified weight loss medicine specialist and certified life coach. In this podcast, I'll share fresh insights and effective techniques for incorporating mindset, habit change, and proven science into your life. Are you ready to achieve sustainable weight loss, wellness, and longevity? Then let's jump in and lose weight the smart way. My daughter, Amelia, was a professional when it came to full-blown temper tantrums as a toddler. Not just the type with a pout, a glare, and a whining voice. She was all in for the tantrum and could drop into one with no warm-up at all. She'd fall to the ground, arms and legs flailing, tears flying all over like Buckingham Fountain in downtown Chicago. Her little fists were pounding, her heels were kicking the ground, and sometimes she'd just scream at the top of her lungs like she was being attacked by a swarm of bees. "It's not fair" was her temper tantrum mantra. We all have a little bit of toddler Amelia in our brains. When other people are ordering mashed potatoes with their meal or a glass of wine or chocolate cake for dessert, it's pretty normal to have a thought like, "It's not fair." And so when it comes to weight loss, we have to watch for that toddler part of our brain who likes to derail us and inadvertently creates unnecessary suffering. Suffering is different than just having something not go our way. If little Amelia wanted candy and I said no, if she just said okay and went back to playing with her toys, that would suggest she wasn't suffering. But when she lay down in front of the entrance to Costco in a full-blown screaming and kicking temper tantrum, which actually happened, it was clear that I wasn't the only one suffering. She was suffering too. Suffering happens when we have some sort of pain and we add resistance to it. In Amelia's case, she wanted candy and I said no. That's her pain point. She can move on and she won't experience any suffering, or she has the choice to resist my answer and push back against the fact that I'm not giving her what she wants. That resistance is what creates the suffering. I think we adults do this too, especially when we're trying to lose weight. I spoke with someone today who mentioned that she's been working on eating healthy and has cut down on sweets for 2 weeks now, and she's only lost half a pound. Let's think about that for a moment. I have clients who might frame that situation in disparate ways. You can frame it like she did. I've been working hard for 2 weeks and only lost half a pound. Or you can frame it like some other clients do. I've only been working on it for 2 weeks and already I stopped the weight gain and lost half a pound. Which of these clients do you think is more likely to lose weight if we fast forward 6 months or a year? Well, having done this job for many years now, I'll tell you who will find weight loss easier. It's the person who's excited for her half pound of weight loss in 2 weeks. She sees a little momentum and she's creating her own positive reinforcement. Her thought and her tone is her reward. Her attitude says, "I'm doing this. This is working." And behaviors that get rewarded get repeated. The good news for my client who's discouraged by only losing half a pound is that we can rewire our brains by changing the way we speak to ourselves and the way we think about our weight loss. It's incredibly common for people to quit, to give up when they get 2 weeks into an effort and feel discouraged. My message to you is this: don't let that toddler brain manage your weight loss protocol. That's our primitive brain speaking. "I only lost half a pound. It's not working. This isn't fair." If you're inclined to think this way, you're not broken, but you are creating unnecessary suffering for yourself by adding resistance to your pain point. If your pain point is that weight loss is hard and takes time, resisting the pace and getting upset about it will amplify your suffering and might lead to giving up. Or maybe you'll have what I call micro quits. These are little moments when you throw in the towel, and if you have enough of them, you block your own progress, which eventually leads to quitting whatever weight loss path or program you are on. In my online program, we dive deep to find these thoughts, catch our micro quits, and redirect our primitive toddler brains so our prefrontal smart brain can run the show. Here's an example of a micro quit. You're out to dinner with friends, and you've been telling yourself lately that your efforts aren't working. So when your friends order some kind of delicious cake for dessert, your inner toddler cues the suffering. Your inner voice tells you this isn't working. You're feeling discouraged, and people who feel discouraged often micro quit. You'll metaphorically fall to the floor, thrash around, and dive into your portion of the chocolate cake. You might use the cake incident as further proof that this isn't working. It's a micro quit if you do this once, but often these micro quits lead to further thoughts of failure, and they multiply in a vicious cycle until you concede defeat. But of course, the good news is that we don't have to be hostage to our toddler brains. Everyone has a primitive brain, but we also have a prefrontal cortex, thankfully. This is the adult part of our brain, the thinking part, that helps us to navigate these moments. The thinking part of my brain can take a look at my inner toddler and say, "Whoa, Lisa, it's okay. Nothing is forbidden. You're allowed to have some chocolate cake." This is one of those moments of cognitive dissonance. Your adult brain can remind you that it's normal to both want the dessert and to not want the dessert. You want it for the party in your mouth, and you don't want it because you're working hard to eat healthier and manage your weight. I like to remind my inner toddler, "Lisa, it's okay. You're not in ventricular fibrillation. No one needs to grab the AED off the wall and shock your chest to restart your heart. You're just sitting with desire for some cake, and it's not aligned with your weight loss goals. No one's stopping you from eating it, but you have a choice." How's it going to feel in your mouth? Probably pretty awesome, right? How's it going to feel in your stomach? Well, maybe I'll find myself overly full and wishing I'd take a pass. How's it going to feel next week when I weigh in? Probably not great then either, since it's hard to have cake and lose weight. I keep resisting the urge to say, "You can't have your cake and eat it too." But it's not that the food is forbidden. Every week doesn't have to be a weight loss week. I can have the dessert, but I want to acknowledge that if I do, I may not lose weight, which is okay. I hold all the cards. It's my choice. And over the course of the year, I have room for weight neutral weeks. I even have room for the occasional weight gain week. An important thing to remember is that we want to schedule splurges periodically so we don't provoke a temper tantrum. If you like chocolate cake, you should plan it and have it without feeling guilty, without shaming yourself, and without regret. I want you to savor it and enjoy it. But you should plan it for a special occasion and not just some random Thursday when you're going out to dinner. It's up to you, of course. You have to decide. Is this the splurge I want to have? Is this the moment that's worth the splurge? Is this the place I want to splurge? And am I surrounded by the people with whom I want to splurge? If not, that's a moment for our adult brain, our prefrontal cortex, to step in and remind us that we have a choice. In fact, the best approach to managing toddler brains is always to offer a choice. If a toddler is melting down because they want candy for dinner, you can redirect them and then offer the choice. "We're not having candy for dinner, we're having chicken. But you have a choice. Would you like green beans or carrots with your chicken tonight?" As soon as your toddler has a little control, they'll often calm down. "Green beans, I want green beans." "Okay then." Peace has been restored. Let your own prefrontal cortex restore the peace when your toddler brain is suffering. Don't judge yourself, but rather just notice who's in charge, your adult brain or your primitive brain. And if you're not feeling like your prefrontal cortex has got it covered, then just give yourself some kind of choice or offer a reasonable trade-off. I'm choosing not to eat the chocolate cake, for example, because I didn't plan to splurge on that tonight. But tomorrow, I might plan for it. Planning our treats at least 24 hours in advance is the goal. Toddlers want things impulsively. Adults might want things impulsively too, but we are more likely to plan things. We can practice calming our normal human primitive desire to eat what we want when we want. It just takes some practice. Nothing ever has to be forbidden when you're working on weight loss. It's always a question of what you want to splurge on, how often, what your portion is going to be, where, when, and with whom you'd like to splurge. We can't unknow what we know about our health and our weight, which is why we want to be thoughtful about our food choices. We all know there's no value in yelling at a toddler who's losing it. That only amplifies the tantrum and creates more suffering for everyone. We want to speak with kindness and a gentle tone. You can do that for your toddler brain too. In fact, this is a nice idea for your NBA, your next best action. I'd suggest that if you're hard on yourself when your inner toddler takes charge of a food craving, there's another way. You can redirect. You can offer yourself choices. You can plan a treat or a splurge for tomorrow or for something over the weekend. You can remind yourself that sometimes things are slow and sometimes weight loss can be hard. And also, please remind your precious toddler brain that nobody gets it right all the time. We all get stuck, and the way to push through it is often by choosing words that will lift you up and propel you forward. Thanks so much for listening. If you'd like more support during your smart weight loss journey, check out our group coaching program at smartweightlosscoaching.com. Until next time, stay well and stay smart.